Welcome. Today, we'll be exploring Machado-Joseph disease, also known as Spinocerebellar Ataxia type 3 or SCA3. This progressive neurological disorder can have a profound impact on a person's life, affecting movement, coordination, and overall well-being. Join us as we delve into the complexities of this condition, from its origins to potential treatments and research advancements. Machado-Joseph disease is primarily caused by a genetic mutation. Specifically, it's an autosomal dominant disorder, meaning that only one copy of the mutated gene is needed to cause the disease. The culprit lies within the ATXN3 gene, located on chromosome 14. This gene contains a repeating sequence of DNA, which codes for the amino acid glutamine. In individuals with MJD, this KEG repeat is abnormally expanded, leading to a longer than normal glutamine stretch within the ATXN3 protein. This expanded repeat is then passed down through families, causing the disease to appear across generations. The expanded CG repeat in the ATXN3 gene results in a mutated ATXN3 protein. This mutated protein tends to misfold and aggregate, forming clumps within nerve cells, particularly in the cerebellum, brainstem, and spinal cord. These aggregates disrupt normal cellular function, leading to neuronal dysfunction and eventual cell death. The cerebellum, responsible for coordination and balance, is particularly vulnerable, resulting in the characteristic ataxia, or lack of coordination, seen in MJD. The degeneration of other brain regions contributes to the diverse range of symptoms associated with the disease. Machado-Joseph disease is found worldwide, but it has a higher prevalence in certain geographic regions, particularly in people of Portuguese descent, especially in the Azores Islands. It's also more common in some regions of Brazil, India, China, and Japan. The exact prevalence varies depending on the population studied, but it's considered a relatively rare disease overall, although it is the most common type of dominantly inherited ataxia. The signs and symptoms of Machado-Joseph disease are varied and can differ significantly from person to person. Common symptoms include progressive ataxia, causing difficulty with balance, walking, and coordination of movements. Other symptoms may include muscle stiffness or spasticity, slow eye movements or double vision, difficulty swallowing or speaking, dysarthria, urinary problems, and sleep disturbances. Some individuals also experience dystonia, which is involuntary muscle contractions that cause repetitive or twisting movements. Symptoms usually appear in adulthood, most commonly between the ages of 30 and 50, but can occur earlier or later in life. Diagnosing Machado-Joseph disease typically involves a combination of neurological examination, family history assessment, and genetic testing. A neurologist will assess the individual's symptoms, motor skills, and reflexes. If MJD is suspected based on these factors, genetic testing is performed to confirm the diagnosis. The test involves analyzing a blood sample to determine the number of phage repeats in the ATX3 gene. An expanded repeat confirms the diagnosis of Machado-Joseph disease. Brain imaging, such as MRI, may also be used to evaluate the extent of cerebellar atrophy or other brain abnormalities. While there aren't distinct classifications or subtypes of Machado-Joseph disease based on the underlying genetic mutation, the presentation of symptoms can vary. Historically, different clinical presentations were classified as distinct types. These types aren't genetically distinct but reflect variations in the predominant symptoms and age of onset. These classifications included Type 1, characterized by early onset and severe ataxia, Type 2, with intermediate onset and a combination of ataxia and spasticity, and Type 3, with later onset and a more prominent peripheral neuropathy or dystonia. However, these classifications are now less frequently used as the disease is understood as a spectrum rather than distinct subtypes. Currently, there is no cure for Machado-Joseph disease. Treatment focuses on managing symptoms and improving quality of life. This may involve physical therapy to maintain muscle strength and coordination, occupational therapy to adapt daily activities, and speech therapy to improve communication and swallowing. Medications can be used to manage specific symptoms such as spasticity, dystonia, and sleep disturbances. Assistive devices such as walkers or wheelchairs may become necessary as the disease progresses. A multidisciplinary team, including neurologists, therapists, and other healthcare professionals, is crucial in providing comprehensive care. As Machado-Joseph disease is a genetic disorder, there are no known preventive measures to stop it from occurring in those who have inherited the gene. Genetic counseling is recommended for individuals with a family history of MJD who are considering having children. Prenatal testing is available to determine whether a fetus has inherited the mutated gene. However, the decision to undergo genetic testing or prenatal testing is a personal one and should be made in consultation with a genetic counselor or healthcare professional. The prognosis for individuals with Machado-Joseph disease varies. The disease is progressive, meaning that symptoms worsen over time. The rate of progression can differ considerably among individuals. Some individuals may experience a slow decline over many years, while others may progress more rapidly. The disease can significantly impact mobility, independence, and overall quality of life. Life expectancy is often reduced, but with proper management and supportive care, individuals with MJD can maintain a reasonable quality of life for many years. Recent research is focused on developing potential therapies to slow down or halt the progression of the disease. These include gene therapy approaches to reduce the expression of the mutated ATXN3 gene, and strategies to prevent or clear the abnormal protein aggregates. Clinical trials are ongoing, offering hope for future treatments that may significantly improve the lives of those affected by Machado-Joseph disease.